M8 Dr. Pen Microneedling Pen. And what we're going to do is we're going to start at different RPM and different depths according to the skin type. So up here in the frontalis area, meaning over the bone, these bony areas we go a little bit less deep to start with. So over there, let's start with maybe 0.5 to 1. Underneath the eyes, we'll probably do a little bit more superficial. So you can start from 0.25 to 0.5. Over here, you can see he's got a little bit of acne scarring, some like pitted scarring. We can go a little bit deeper, starting about 2.5, then we can come up in depth from there. So I'm going to go ahead and get this started. We're about 0.5. I'm going to press this button to start that off for RPM of 1. And then we're going to go ahead and add the hyaluronic acid serum. I'm going to turn your head this way. Okay, my assistant will add the serum. Okay, and this is our hyaluronic acid serum that we get from Face Med Store. And I'm going to get started, and you're going to feel a little bit of like a tingling feeling, little discomfort, but it should be mild. And the way that I like to do microneedling on the skin is to go from a deeper depth. You can start at about 2.5 millimeters and then work your way all the way to resurfacing, which is about 0.25 millimeters. We can do circles, multiple passes. Multiple passes will give you improved results. Or you can do up and down, our vertical lines, then we do our horizontal, and then you can do your diagonal lines. And again, we're getting this onto his skin, multiple passes to improve texture, to improve the appearance of his hydration. Anything else you want to add, Dr. Cheuck?
Yeah, so I think, a couple of benefits. First of all, you need a serum that you're going to be putting on the face, which allows the microneedling pen to glide and also allows the skin to be hydrated in the process. In addition, you're looking for certain endpoints when you're doing the treatment. In general, you at least want to see a little bit of erythema or redness and some pinpoint bleeding. That lets you know that you've done an appropriate treatment where you're going to see improvement in the tone and texture of the skin.
You can start to see there's some pinpoint bleeding over here, over the acne area, the scarring. And that's going to help to induce more collagen and elastin and make the skin texture visibly improved. Also helps with fine lines and wrinkles. Okay, so we're good there.
Perfect. Yeah.
Okay.
So what depth was that?
A 0.5.
Yeah, good. Perfect.
Turn this way towards me. Let's do this side just so he has a full treatment. Okay. Okay, go ahead and start adding on. So now we're going to go to the other side, and again, we can change our depth and our RPM. Let's do a little bit more. We want a nice amount of HA on there from our Face Med Store in order to make sure that there's proper glide. Again, you're going to put your finger on there for 3 seconds to start the microneedling. And in this area, I do love to do my circle technique. But again, once you get to nasolabial folds, for instance, an up and down technique may work better. Sometimes a horizontal technique works. Whichever technique you choose, you just make sure you get adequate coverage and that make sure that your needle is always on the skin. So don't come off of it, don't tip. It's got to be flat onto the surface of the skin. And then you do multiple passes at different layers. The deeper you are, believe it or not, the less uncomfortable they are. It's usually the areas that are more bony, more superficial. And as you are more superficial with your needle, as you can adjust the depth, because it goes from 2.5 depth all the way to 0.25, and even more superficial than that. And that's better for skin resurfacing, needle more superficial.
And one of the great things about the M8 is it really does have a lot of power. You're on what setting right now?
This is a 1.
This is 1. Can you put it up to 5 or 6 and you can hear the difference?
That's 2, 3, 4, 5. So I'm going to start with 5. And you'll see it's really the same needles are going in and out, giving you that nice, clean penetration into the depths that you're looking for.
Yeah, so it really speeds up the process, and certainly if someone can tolerate it, you can use the higher speeds, and that's going to enable you to reach those endpoints a lot quicker.
Perfect. How did it feel?
Great.